Namaste, a very good morning, good afternoon, and good evening to all of you. Thanks for joining us today for the global media briefing in lead up to the United Nations General Assembly high-level meeting on antimicrobial resistance, or AMR as we call it. This media briefing is hosted by Global AMR Media Alliance, or GAMA. Historically, the upcoming UN General Assembly high-level meeting on AMR, or UNHLM on AMR, that is being convened in New York during the 79th session of the United Nations General Assembly, is the second of its kind. The first such meeting was held in 2016, the political declaration of which was a milestone in the world's commitment to tackling AMR. It called for greater urgency and action in the AMR response, with the world leaders committing for the first time to take a broad and coordinated approach to address the root causes of AMR across multiple sectors, especially human health, animal health, agriculture, and the environment. This year's UN high-level meeting on AMR is a pivotal opportunity for world leaders to agree on an inspiring vision, commitments, and actions to save lives, protect countries from the growing impacts of AMR on human health, agri-food systems, animals, plants, and our environment, and also ensure that effective antimicrobials are available and affordable when needed for current and future generations. Today, we have with us a very high-level, distinguished panel of speakers, including AMR survivors, youth leaders, and senior experts from the quadripartite organizations that have unified to address the threats of AMR to global health security. These quadripartite organizations include the Food and Agriculture Organization of the UN, or FAO as we call it, the UN Environment Programme, UNEP, the World Health Organization, WHO, and the World Organization for Animal Health, WOA. Some quick housekeeping announcements before we begin. Participants can please type in their questions and comments in the Q&A box, even as the speakers present. You do not have to wait till the end of the session. Also, please mention the name of your media outlet. Only questions relevant to the topics under discussion today will be taken up.
Sure, can't hear you. Probably something happened.
Bobby, maybe you can take over.
All right, thank you so much for good introduction, Shoba. So I think we can continue. And I will start by introducing myself. I'm Pierre Nyemazi. I work with the WHO. My current position is the acting director for Global Coordination and Partnership Department at WHO, but I also serve as the interim director for the Quadripartite Joint Secretariat. And I will speak more about the Quadripartite Secretariat as well in a minute. But again, I want to say thank you for inviting us, and thanks as well for GAMA to organize such important event. We're happy to meet and speak to the media, and we recognize the critical role that you will play in the success of the AMR response. So allow me to share a few slides, and then I'll talk through that quickly. And as Shoba said, can you see my screen? Thumbs up, Hori, can you see my screen?
Yes.
Fantastic. So I'll quickly just give a picture of what has been the road conducting us to this second high-level meeting. You might recall that in 2014, that's when we had the first ministerial conference on AMR. AMR doesn't mean it started in 2014. AMR has been an issue that has been documented since the first antibiotics was developed. Back in 1940, we knew that antimicrobial resistance is going to be a big issue. But I would say that big political attention started back in 2014 when we had the first ministerial conference on AMR. In 2015, we had the global action plan to address AMR, which was a critical milestone as well. And this plan has been leading us in terms of what we decide to do to address AMR across sectors. 2016, Shoba mentioned it. That's when we had our first high-level meeting on AMR. And as Shoba said, a high-level meeting on AMR means a lot. That's when you have the heads of government and heads of states meeting in New York, and they come up with a political declaration or a commitment document that decisively say, we will do this and that. So it's a critical moment. And in 2016, we were lucky to have the first ever high-level meeting on AMR at the United General Assembly. And that has driven really much of the key results that we can see today. 2017, that's when the Intelligence Coordination Group was put together. And in 2019, they just released the report that also called for what we see today as well, including the governance, requesting the quadripartite organization. At that time, it was tripartite organization because UNEP hasn't joined by then, officially, I would say, calling for them to come together and co-lead or coordinate the global action against AMR in a One Health approach. Because AMR being a cross-sectoral and really affecting more than one sector, the response has to come from all the sectors again jointly to address this issue. 2020, we had the Global Leaders Group that was established, which is an advocacy group chaired by Her Excellency Prime Minister Moti of Barbados. And they have been vocal in terms of raising the political aspects of AMR and making sure that AMR is being addressed at a high-level political agenda. And then, as I said, in 2022, we're lucky and happy to have UNEP joining the Quadripartite organization officially. And at that time, we also had our joint strategic framework that I will speak about in a minute, that really defines the joint collaboration of the four organizations in addressing AMR. Then we're looking forward for the 2024 high-level meeting, and I'll speak again a little bit about it. This is the guiding strategy that guides the cooperation of the four organizations for addressing AMR. This has been validated and signed off by our top leaders. The four principles of this organization came together and also agreed that this is a strategy that governs our joint collaboration in addressing AMR. As you can see, and that has been introduced by Shoba, the goal is to preserve antimicrobial efficacy and ensure sustainable and equitable access to antimicrobials for responsible and prudent use in human, animal, and plant health, contributing to achieving the SDGs. So there is a strong link between AMR and SDG, the Sustainable Development Goals. So the strategy that we have that governs our collaboration or joint collaboration has also considered that. We operate under Quadripartite Joint Secretariat, which is a standing secretariat hosted by WHO, but that contains or that is composed by experts, high-level experts from the four organizations. And we meet every 2 weeks. We discuss and decide on what we do jointly. And it's a platform where we also provide and develop some tools that could help the countries to implement their strategies. And that's where we can actually engage the media as all of us together so that we can, comprehensively speak about AMR as an issue, but as well discuss the strategies to address AMR across all the sectors. So we host a number of other functions under the Quadripartite Joint Secretariat, including the governing structures such as the Global Leaders Group, the multi-stakeholder partnership platform, the trust fund that also supports the work that we do. So it's a working relationship, I would say, and as you have probably seen in the draft political declaration, we have also requested that this function arrangement be strengthened so that we can continue to provide this global leadership and coordination in a One Health approach to addressing AMR. Now, let me go back quickly to the high-level meeting and what we are preparing for, or we are prepared for. It's a process that started earlier back in 2023, where we had the decision made of appointing the co-facilitators. The co-facilitators are two ambassadors in New York who basically coordinates the process, but also draft the political declaration and conduct the negotiation between the member states. That started earlier in 2023, and back in May of this year, that's when we had the first draft of the political declaration. And there have been a series of intergovernmental negotiations. The last one concluded just by end of August. And in a few days back, I think only 3 days ago, we got the final text of the political declaration, which has been submitted to the member states, and which is going to be the basis of the discussions in New York on 26th of September. So I suspect you might have all gotten that because it's online, it's available on the Office of the President of General Assembly website, so you can access it and you can already look in the draft and see what are the commitments being proposed. What I wanted just to raise is that the main theme that has been decided on for this year high-level meeting, as you can see on my slide, is about investing in the future, in the present, and securing the future together, accelerating multisectoral, global, regional, and national actions to address antimicrobial resistance. And this theme came from different discussions that we've been having in this area. 2016 was a milestone. The high-level meeting in 2016 was really a milestone and helped to achieve a lot. But this time around, we still have very high burden of AMR. I think you've heard about almost 5 million people or 5 million deaths associated with AMR. That's still a big issue. And we know that most of these deaths, they're coming from the low and middle income countries as well, because they are key drivers, as my colleagues will probably touch on that. So AMR is still a big issue, and then we requested that this upcoming high-level meeting decides on key actions really to address AMR, things that will drive key changes on the ground in the countries, things that are going to bring new financing to address AMR, the things that are going to improve the coordination between these four sectors, to improve how we coordinate between human health, animal health, agri-food systems, and then also the environment, because those sectors are all key in terms of contributing to the response. So the Quadripartite organization, for that purpose, issued key messages, and we also supported technically the process and provided the key areas that we think should be considered. I don't want to read them because you have them in front of you if you're looking at my slides. It's about financing, it's about effective governance, it's about investing mainly in prevention. It's also about research and development and addressing issues of inequitable access to antibiotics and other antimicrobials and also diagnostics. But it's also about accelerating support to countries so that they can address AMR as it should be. At the same time, the Global Leaders Group that I spoke about, which is also facilitated by the Quadripartite Joint Secretariat, they issued a report that was also containing about 10 recommendations that were pretty aligned with what I just said. It's about finance, it's about governance, it's about really concrete actions. And what we called for mainly that we want also you to be promoting as you continue your advocacy is that we need the leaders to agree and commit to specific and really, if possible, targets and outcome-oriented actions. Because it's easy to commit to broad statements, but we've seen that they don't get implemented. If they are too broad, if there's no specific stakeholder being mentioned to follow up with that, at the end of the day, you don't see things done. So we need to see commitments that are really specific and bold and outcome oriented that are going to trigger the actions. And that's how these two groups I spoke about, the Quadripartite and the Global Leaders Group, have really called for. We also have, under the Quadripartite Secretariat, the stakeholder partnership platform, as I said, more than 200 stakeholders are involved, and they are coming from different areas, government, civil society, private sector, all sort of professions as well. They are really called to be part of this large group. And they have also issued key recommendations that are pretty aligned with what I just mentioned. Now, the day of this meeting is going to be on 26th, as we said, and it's going to be a full day meeting. It's a meeting that is attended by the heads of states and the ministers in those sectors that I just mentioned, but also experts, civil society organizations, and the other stakeholders are invited to attend. And it goes by the opening that starts in the morning. There are plenary where the member states do speak. There are also some panels or panel discussions that are also going to be conducted. So basically, looking at what has to be done to really fight such, and defeat AMR as much as possible. Now, let me end by these few elements. In terms of the role of the media, we see this as a critical role. And we believe the media, since even our assessment that we conducted as Quadripartite organization, we already identified the media as top priority target audience for us. Second, we believe the media is still a powerful engine to raise the profile of AMR and call for AMR response at all levels. So we believe that media can really help us to do things that we can't do, because they have this big voice that can really be very instrumental as we try to address AMR. The media will help to raise awareness among the public, but at the same time, the media ensures accountability from policymakers and agencies responsible for the implementation of AMR actions. I think we really believe in the role that the media can provide through these elements. Now, what we request for you today, we would like you to advocate for the high-level country representation. So it's not a given that the member states, all of them, have come to agree and to really see the AMR as a top priority. They might be in New York, attend other events, but they might not maybe go to this one. And we need the high-level leadership from the countries to be there and really speak about AMR and make commitments. And the media, you can help with doing that within your own media networks. We need, at the end of the day, the high-level meeting will going to happen on 26th of September, but it's not an end result itself. So we need a continued political commitment, and the media will be very helpful to make this happen. And then at the end of the day, we still require you to step up the ongoing advocacy and awareness efforts into your daily work. And we, again, stand ready. We've come up with some tools that will be helpful as you exercise your role, the media toolkit being one of them. But we remain available as well to continue to work with you and facilitate your role. And in turn, it also helps us to achieve what we have to achieve. That was it for me. And again, thank you. I'm not sure if Shoba is back.
Thank you very much, Dr. Nyemazi, for setting the stage of the global media briefing and for rightly pointing out why it is important to tackle AMR to achieve SDGs and for protecting the present and securing our future through bold commitments of world leaders and concrete action on the ground. Now let us listen to Dr. Junxia Song, Senior Animal Health Officer of Food and Agriculture Organization of the UN, on how AMR impacts food and agriculture sector. Welcome, Dr. Junxia. Over to you.
Thank you, Shukla. Let me put on my slides.
Yes.
Did you see my slides?
Yes, in this, put it in the slide mode. We can see your screen. Yes, perfect.
Okay, thank you. Good morning, good afternoon, and good evening, dear colleagues and friends. Thank you very much for inviting me to speak today. As we come together ahead of this UNGA AMR high-level meeting, we are at a very important point in our global fight against this most important threat to health and also to the development. AMR is not just a threat for health sector. It is a very complex crisis that impacts every aspect of our lives, especially within the agri-food system. The misuse of essential drugs in food production, whether in livestock farming or aquaculture or crop production, accelerates the emergence and spread of resistance. So these resistant strains can transfer from animals to humans through direct contact or through the agri-environment or the food chain, creating this kind of cycle that worsens the AMR crisis. So this also has significant implications for food safety, food security, and economic well-being of millions of farming households. So we are already seeing this common bacterial infection become harder and sometimes impossible to treat. So, but AMR threatens these livelihoods of 1.3 billion people who depends on livestock. So the World Bank projects that in high AMR impact scenario, this livestock production in low-income countries could decline by 11% by 2050, raising costs for farmers and driving up food prices. And also, we know that one of the major challenges in addressing AMR in agri-food system is the limited funding available. So here, there is an example, just 4% of research and development funding is directed to support AMR response to the agri-food sectors. FAO has responded to tackling AMR by supporting, at the moment, over 70 countries in building their capacities to minimize and control AMR. This is achieved through the implementation of FAO Action Plan on AMR from 2021 to 2025. So which include, for example, in strengthening awareness, surveillance, evidence, and governance. So to tackle critical challenges in the agri-food system, we are introducing concrete solutions. So one key approach is to promote the responsible use of antimicrobials in the agri-food system, support the development of alternatives, and reduce the reliance on those drugs by promoting best practices at farm level. So in this effort, FAO has launched the Reduce the Need for Antimicrobials on Farms for Sustainable Agri-Food System initiative. This is a 10-year initiative. We are aiming to equip over 100 countries with the tools and the knowledge necessary to minimize the need for antimicrobials in agri-food systems. This initiative will focus on fostering the good health services, good production practices, good alternatives, good connection, and good incentives at the farm level. So those are the three targets for this 10-year initiative. 100 countries to participate, 50% of animal plant health workers will be trained, and 80% of participating countries will be supporting their surveillance system. So we have also launched the first call for data for the international FAO AMR multi-neural system in farm. The goal is to enhance countries' capacity on surveillance and generate high-quality surveillance data that aligns with both national and international standards and supporting evidence-based action to combat AMR. InFarm is a key part of the global integrated surveillance system alongside global WHO GLASS and Wuhan animals, which is established by the Quadripartite. So, however, the challenge of AMR in food and agriculture cannot be tackled in isolation. It requires a comprehensive One Health approach that recognizes interconnection of human, animal, plant, and environment health. So FAO, in collaboration with the Quadripartite partners, is committed to this integrated response. As part of this effort, FAO is proud to host the AMR Partnership Multi-Stakeholder Partnership Platform on behalf of the Quadripartite. It's a global, inclusive, and collaborative platform established following the 2019 RACG recommendations, one of the global governance structure. My colleague GP already gave a very comprehensive introduction about the global governance. So we are very happy. We thank the members to recognize the platform in the draft high-level meeting declaration as a global mechanism to facilitate the multi-sector exchange of experiences and the best practices, and to assess of member states' progress in implementing national action plans on AMR. So the high-level meeting on AMR is pivotal opportunity for the world leaders to reaffirm their commitment for tackling AMR. So we must seize this momentum to advocate for stronger governance, sustainable financing, and outcome-oriented actions that address the root cause of AMR across all sectors. In the context of food and agriculture, and this means ensuring that political declaration from a high-level meeting reflects the urgency of the AMR crisis and the need for immediate coordinated action to safeguard our food systems. We must call for evidence-based policies that promote responsible antimicrobial use, invest in research and innovation, and support farmers in adopting sustainable practices. As journalists and media professionals, you are playing a crucial role in shaping public understanding of AMR and holding governments accountable for their commitments. Your reporting can really amplify the voice of those affected by AMR, highlight the solutions being implemented around the world, and inspire action at every level of society. We need your support to use your platforms to raise awareness of the importance of agri-food system in fighting this AMR crisis, to highlight the stories of those on the front line to take decisive and bold actions. So the UNGA high-level meeting will be an important step, a milestone to accelerate AMR efforts. We should start to think about the implementation in a more holistic, efficient way by working together across sectors, disciplines, and borders. We can build a future where antimicrobials remain effective tools in our fight against disease, and where our food systems are safe, sustainable, and resilient. Thank you very much.
Thank you, Dr. Junxia, for your valuable insights. Food indeed is life-nourishing, and it is important to ensure that misuse and overuse of medicines does not happen in food and agriculture. Let us learn more on the link between AMR and environment. We have with us today Aitziber Echeverria, AMR Coordinator, Chemicals and Health Branch, Industry and Economy Division of UN Environment Program, or UNEP. Welcome, Aitziber.
Thank you, Yvan. Good morning, afternoon, or evening to all. Can I ask colleagues to please put on the presentation? Thank you. It is a great pleasure being today with you. Thank you for the invite. As mentioned, I will be providing a flavor of the environmental dimensions of AMR, which in many cases is the least known sector. First slide, please. While my colleagues are commenting on it, let me also emphasize that in the past, the global attention to AMR has been dominated by a focus on the human health. But realizing how multifaceted it is, nowadays there is a widespread agreement that tackling it requires a multi-sectoral approach. A systems thinking like the One Health that considers the health of humans, animals, plants, and the wider environment, including ecosystems, as interconnected and interdependent. Next, please. With this in mind and with the knowledge and evidence that is mounting, UNEP is fully committed to work together with the Quadripartite and also on sector-specific aspects on strengthening the environmental aspects to prevent and manage AMR with a One Health approach. For those who are less familiar with it, UNEP, the United Nations Environment Programme, is the leading global environmental authority. Next, please. To put into context the AMR work within the organization, AMR is part of the Chemicals and Pollution Action, working with other thematic and enabling and foundational programs as represented on the slide. It is important to say that while UNEP is not a scientific organization, it is driven by science, so using science to inform policies and action. Next, please. UNEP's governing body is the United Nations Environment Assembly, who recognized at its third session the critical, current, and increasing threat and challenge of AMR, and requested UNEP to develop a report to better understand the environmental dimensions of AMR. Next, please. Last year, in February, UNEP launched in Barbados on the sidelines of the first in-person meeting of the Global Leaders Group on AMR, the group that my colleagues have already mentioned as part of the governance architecture, the report Bracing for Superbugs. The report was prepared in consultation with a number of experts in different fields, and it's considered a landmark report with the most comprehensive overview of scientific findings on the subject. Next, please. So why the environment is important in tackling AMR? Broadly, I would say threefold to consider. Firstly, the environmental microbial world, if we can call it that, like this, is the source of genetic material that confers resistance to antimicrobials and the machinery that underlies genetic transmission. Secondly, various anthropogenic pressures are potentiating or aggravating the problem, for example, pollution. And this is linked, among others, to the overuse and misuse of antimicrobials that were already mentioned. And lastly, the environmental dispersal of AMR via water, air, soil is crucially important for the transmission and spread of AMR. The evidence is mounting that the environment plays a significant role in the origins, the development, spread, and transmission of AMR, including the emergence from the environmental resistance and transmission between humans and animals to humans. Indeed, the environment is a critical mean by which AMR is transmitted and spread across the One Health continuum. So if we want to reduce the burden of AMR and its risks, we need to focus on the environment. Next, please. The report also identifies the key economic sectors and the value chains that have an important impact on AMR in the environment. Those are pharmaceutical production, agricultural and food value chains with antimicrobial use and manure in crop production and waste and other releases from the animal production, and healthcare value chains where antimicrobials are used, so the waste and effluents from healthcare facilities. Also, among the most important sources of resistant microorganisms and antimicrobial resistant genes to the environment is the human waste that end up in sewage, wastewater, or landfills. Next, please. The reports includes a call to action based on the findings, and those are the main areas of work for UNEP. Priority actions identified include enhancing the environmental governance, planning, and regulatory frameworks at global, regional, and national levels. For example, strengthening the environmental interventions that are included in the AMR national action plans. We know that a number of countries have developed national action plans. Not many funded, but that is a different subject. but even those that have been developed are not necessarily addressing properly the environmental aspects. So it's important to include and strengthen properly the environmental interventions in those. And also, same time, including AMR into the environmental planning, so making the agendas speak to each other. For example, many countries have waste management regulations and plans, but they need to include antimicrobials and the safe disposals in them. There is also a need to generate more evidence and knowledge on environmental aspects to inform policy by improving reporting, surveillance, and monitoring, and more research. But something important to note is that while we need to know more, that is sure, we know enough to act. Raising awareness is another important area of work, and there is an arrow there because this is a key contribution that can generate the change and for which media is fundamental, commented already by my colleagues JP and Junxia. Also key is to scale up preventative actions with private sector engagement, addressing key value chains that are the main drivers of AMR in the environment, to prevent and manage the discharges and ultimately reduce the risks of AMR. These are, as I have mentioned, effluents from the production of pharmaceuticals, the runoff of antimicrobials, including pesticides from farms and intensive crop production, hospital effluents and waste, and municipal waste and wastewater, all with strengthening capacities in countries to tackle all these. And emphasizing that prevention is key. We don't need to tackle a problem if we don't generate it. So we need to keep in mind that the investment in prevention is really key. Next, please. The last one, previous one, please. Sorry. Yeah. Thank you. The last version of the political declaration to be considered by member states at the UNGA high-level meeting on AMR in a couple of weeks reflects these concepts and provides elements to further boost the environmental dimensions of AMR. This is vital to reduce the burden of AMR and reduce the risks associated to it while we protect the planet. Last slide, please. Thank you so much again for the invitation and for your support in combating AMR. Thank you.
Thanks, Aitziber, for connecting the dots between AMR and environment and including AMR response, rather requesting for including AMR response in all environmental plans. Our speakers have set the perfect stage to understand how AMR impacts human health, as well as how to address AMR using the One Health approach. I now invite Dr. Yvan J.F. Hutin, Director, Department of Surveillance, Prevention and Control at AMR Division in the WHO, to share his insights. Welcome, sir.
Thank you so much. It's such a pleasure and honor, and I'm so impressed by the eloquence and precise statements of my colleagues. I do not see the button to share the slides on my end, which was, oh, now it's there, so I can do it. For some reason, it was not apparent. Apologies for this. Can you see my screen correctly?
Yes.
So we're ready to go. So thank you so much for this opportunity, and I will try to provide now a bit of a focus in the health sector. So my name is Yvan, and I work in the Department of Surveillance, Prevention and Control at WHO headquarters. So we're trying to mostly address what's happening with AMR in human. And I would like to take us back to the 20th century. On this graph, you can see what is happening when we, human, invent antibiotics. So on this graph, you can see that on the axis vertical, you have a number of antibiotics, and the x-axis, we have the years. And you can see from the beginning to a more recent time, the names of antibiotics that have been emerging or discovered, and how fast, at the head of the arrow, resistance has been reported. So you can see that sulfonamide, for instance, came up in the 1930s, and within 10 years there was resistance, then penicillin, and etc. So first, you can see that whenever we have a new antibiotics, there's always resistance that's emerging sooner or later. And you can see, second thing, that for those fancy antibiotics that we developed since, for instance, the 80s, that I was in medical school, the emergence of resistance is particularly early after the discovery of the new antibiotics. So that is really a problem, because every time that we are smart at inventing an antibiotic, the nature is quite fast in evolving and finding a countermeasure. So should we actually continue to invent? Well, the problem is that our pipeline is dry. Our capacity to actually even add some more antibiotic on this graph is not what it used to be before. And only 6 antibiotics active against what we call the WHO bacterial priority pathogen fulfill at least one of the WHO innovation criteria. And of these, only 2 are active against at least one of our more critical bacterium that we're worried about. So resistance is emerging and the pipeline is running out. This is why, for the human health sector, we need action. So in 2024, our member states at the World Health Assembly in May have endorsed what we call our strategic and operational priorities to address drug-resistant bacterial infection in the next 10 years. The aim is actually to slow the emergence and the spread of drug-resistant bacterial infection and make sure that we keep our antibiotic working. We have 4 strategic priorities. Number 1, we want to prevent infection. That can be done through water and sanitation, through immunization, and through, most importantly, maybe infection prevention and control, which is both preventing all infections and preventing the spread of drug resistance infections when they have emerged. Second, we want universal access to affordable, quality, diagnostic, and appropriate treatment of infection. We want people with infection to be diagnosed and treated. Third, we want what we call strategic information, science and innovation, so to be guided by science. And fourth, we want effective governance and financing. For these 4 strategic priorities, we have 3 modus operandi, if you want, that we call these operational priorities. The first one is a people-centered public health approach and core package of intervention. We used to think a bit of AMR like doctors in terms of bugs and drugs and science. And so now we've actually reformulated an approach by which we place this at the heart of primary healthcare for universal health coverage. Second, we want to enable regional and national action on governance and financing. And finally, we want to make sure that all our member states can act and that we're ready to support them. I want to spend a moment to actually talk about this classification that WHO came up, which is actually quite smart and quite simple. It looks actually like a traffic light. We've basically looked at the science and we've broken down our antibiotics in 3 categories. We have the green antibiotics. They're the, if you want, the go-to antibiotics. Those that anybody should be able to use for common infection. They have the lowest resistant potential. Then they have the orange one, which are the ones that have higher resistant potential. These are for the not so common infection. And then we have the red one that we call reserve. Those are the ones that we should keep as a last resort and really try to use only when they are absolutely necessary. Otherwise, as we discussed, resistance will emerge more easily. And as you can see, it's a pyramid, so we should use more of the access, a bit less of the watch, and a small proportion of the reserve. So this pyramid approach that we try to promote into policy, into behaviors of doctors, is really one of the keystone of our approach. And one of the targets in the draft political declaration is based on this, encouraging countries to mostly use access antibiotics. I want also to spend a quick moment to discuss this patient-centered approach that I referred to. So as you see, it's a house with some foundational steps in terms of governance, awareness, education, then in terms of science and strategic information. And then we have these pillars of prevention, of access to services, of timely, accurate diagnosis, and quality assured treatment. So that is what I wanted to share with you. Now, from a journalist and media point of view, in terms of what you want to consider in terms of the coverage of the UNGA, I have a potential set of suggestions that we can discuss further during the Q&A. Does your country has actually a national plan for AMR? That would be an interesting question to ask yourself. Then, if that is the case, does your country actually equip that national plan with actually money so that it can be implemented? Does your country has a national plan for infection prevention and control? Because as we've seen, there's a particular synergy between IPC and AMR. And does your country report the surveillance data on AMR to WHO? Because as we've seen, AMR has no borders and surveillance spread. So unless we're able to monitor all the countries and have that centralized by WHO, it's hard to map out what the issues are. And finally, does your country actually keep track of its consumption of antibiotic as per the AWARE classification? That would be a useful question to ask, because in the human sector, it's one of the most important interventions to slow down the emergence of AMR. So I really thank you for your attention, and I look forward to more discussion.
Thank you, Dr. Yvan Hutin, for such a lucid presentation. And we really loved your traffic light analogy of access, watch, and reserve to antibiotic use to avoid AMR accidents. And also helping us all to understand the impact of AMR on human health, as well as the critical role of One Health approach in addressing AMR across sectors. One important aspect is how misuse and overuse of medicines happens in animal health sector. We have amongst us Dr. Holy Teneg Akwar, Deputy Head of the AMR and Veterinary Products Department at the World Organization for Animal Health, or WOA. Welcome, Dr. Holy.
Thank you very much, Soba. I will share my screen.
Yes.
Can you see my screen?
Yes, very clearly.
Okay. Okay. Thank you very much for the opportunity to participate in this media briefing. I will just go straight away to talk about AMR and the animal health perspective. Just to remind us, since we have the media as our main audience today, to say AMR, as my colleagues have mentioned, is a complex problem. It is described as a silent pandemic. It's a silent killer, and these are the things that make AMR a wicked problem. It is faceless. Often, when it affects or contributes to the mortality of an animal or a person, the underlying disease is blamed and AMR goes unnoticed. So most of the estimates you see out there are underestimation of the real impact of this wicked global challenge. And again, it's a slow pandemic. Unlike COVID, it's something that when you overuse, misuse antimicrobials, the resistance doesn't emerge immediately. It takes some time before it comes to fruition. Then with regards, I picked one of these commitments that was made by the political declaration of 2016, requesting for the enhancement of surveillance and monitoring to show what is being done at the global level. Here at WOHA, we've developed this Animus, which is a global dynamic database system that captures information on antimicrobial use in animals. And our colleagues at FAO have also developed, as my colleague mentioned, the in-farm surveillance program that captures information on antimicrobial resistance in animal. And our colleagues at WHO have developed the WHO glass that captures both in antimicrobial use and resistance in animal. However, despite this system, we still have challenges, particularly regarding things like data sharing across sectors. That still remains a challenge today, and even within sectors. For instance, sharing information between lab and the clinical departments may still be a challenge in some areas, and we have a significant investment infrastructure issue as well as capacity, which my colleagues already alluded to. And these are some of the things that need to be addressed in order to cope or contain AMR. Specifically at WOHA, in addition to WOHA being a standard setting organization, we've developed standards and guidelines for AMR and antimicrobial use that are available on our website. We've also, as I mentioned earlier, developed this animal surveillance system, which currently we have about 152 countries that are reporting into data into this animal system. Reports are being generated every year. Now we are on the 8th annual report that has been published. The website is just beneath which you can access to get more information on whether growth promoters or trend over time as it's been reported. We report quantities of antimicrobial use per country. For instance, we're reporting that for 94 countries, and as well for countries that have been reporting the trend consistently, we also have trend information for 81 countries. And when I mention these countries, you know that there's still a significant challenge or gap to encourage all other countries to report data to the animal system. And we're hoping that with the media involved, this will change after this event. Then we also have another surveillance system that we have in place to monitor substandard and falsified veterinary medicine. You know, depending on the setting, these substandard and falsified medicines create a huge pressure for resistant emergence. And if it is not monitored and appropriate intervention or actions taken, the situation will really get worse. So we've initiated this. It's still a pilot phase now. We call it VSafe. We started in 2022, just in English. At that point, we started with 14 members or countries, and then improve it into French and Spanish. Then we had 42 countries now reporting substandard and falsified medicines. Presently, we have 62 countries. The graph on the left-hand side is just showing you the proportion of countries that are reporting. For instance, in the African region, we have just 20 countries reporting out of the 54 countries, and we say that for the rest of the region. And as you can see, very, very few countries are reporting into this system, but this is a critical aspect of AMR that contributes to AMR that we need to monitor to be able to curb the problem. And then on the right, it just shows you the proportion of countries that are participating, which is still far below even 50%, implying that we have a lot of advocacy work to do to encourage, just as my colleague, Dr. Yvan was saying, media can help to ask questions like, are you reporting or participating in these surveillance systems? Then WOHA also heading up to UNGA. WOHA identifies some 4 priority areas that we wanted to advocate leading up to UNGA. And the first is implementation of an effective cross-sectorial coordination. As my colleagues mentioned, about 93% of countries have developed their national action plan on AMR, but an effective multi-sectorial coordination mechanism remains a challenge. And this applies even to developed countries. It cuts across where this is a challenge. Therefore, we are urging countries to implement a multi-sectorial national action plan that clearly identifies and fund priority needs for all the sectors, because the funding is not equally distributed across the sector. We're encouraging that that should be done, and the animal health sector should be considered and funded accordingly. The second is resource surveillance systems. Again, we have just 42% of WOA members out of the 183 countries, just 42% of member states have an integrated multi-sectoral system for AMR in place and antimicrobial use. Hence, we just add our voice to advocate for national surveillance system to be strengthened and institutionalized so that we can have evidence-based policies and intervention or response. The third one, as my colleague mentioned over and over, is prioritizing prevention, as Director General usually puts it. There's no need containing AMR when we have the option to prevent infection in the first place. And we are hoping that if we can enhance access to high quality vaccine, along with good animal husbandry practices, biosecurity, diagnostics tools, and alternatives to antimicrobial, these things will help prevent disease in the first place and the need to use antimicrobial, which exerts the pressure for resistant emerging. Hence, we're calling for countries or member states to aim at having a defined animal vaccination strategy according to the WHO priority list of diseases where vaccines could reduce the use of antimicrobial, but also ensure that these strategies are funded and implemented. Probably set a target by 2030, they have these funded strategies in place. And the final one is adequate funding. We cannot overemphasize the role of financial challenges that country face in implementing this. So if you look at the graph, the chart on the right-hand side, it just shows you the fourth bar there is showing investment in vaccine development. And as you can see, just about 7% of investment goes for vaccines in the animal sector, which is really, really inadequate if we actually want to prevent this problem. Hence, we are advocating or calling for sustainable and predictable resources. Funding need to be established at the national and global level to support research and development for AMR response and the implementation of cost-effective intervention in all sectors. And this, as we said, includes vaccines. And then here, just this is more an announcement that WOHA, with the help of funding from the UK government, has led a cross-sectorial study that will be released in the next 2 weeks, late because it was conducted just to inform UNGA. It is looking at estimating the health and economic impact of AMR, both in humans and food-producing animals. Particularly for the animal sector, this will probably be the first time that we're actually looking at the global impact of antimicrobial resistance in the animal sector. So I encourage you to stay tuned for the release of this report within 2 weeks from today. And as you can see, we pulled together international global institution and expert organization, including IHM Graham Center for Global Development, the World Bank, RAN Europe, and animal industry data in Korea to bring this study to fruition. I will wrap up by saying, given the fact that we're talking to media, we said media is the best agent to advocate things, not only to policymakers, but you have that expertise to coin things in a way that even the general public can be mobilized, because AMR requires a whole of societal approach. We're hoping that you can advocate for sustainable, predictable funding resources to curb AMR using a One Health approach, encourage implementation of cost-effective intervention across various sectors, and strengthen the animal health system. Prioritize preventive measures, as we've mentioned, and also the underfunding, particularly for animal health, things like vaccines development and utilization, and also engage respective governments to implement their national action plan, engaging all sectors, and we emphasize, literally spell them out, human, animal, plant, and the environment. Thank you very much for your attention, and look forward to any discussion thereafter. Thank you.
Thank you, Dr. Akwar, for highlighting how AMR impacts animal health sector and how to address it through effective and integrated multi-sectoral coordination mechanism, and also increase the emphasis of vaccines for the animal sector. Friends, we are at an important point in today's session as we transition from understanding the issue of AMR towards listening to people who have personally experienced and survived it. It is my great honor and pleasure to welcome Vanessa Carter, an AMR patient survivor and a powerful One Health advocate. She serves as chairperson of the WHO Taskforce of AMR survivors. She is also the founder of the AMR narrative and is a patient advisor to several organizations. Over to you, Vanessa.
Thank you so much also for Shoba for introducing me, and thank you so much for having me today. I think listening to everybody's contributions, this is always teaching me as a patient advocate because I have a non-scientific background. So, to start, as you can see, I have a facial difference. Some people call it a facial disfigurement, but I prefer to call my disability a facial difference. And I'll talk a little bit about that now. So this is my last photo at age 25 years old. On the right-hand side is me, my mother, and my grandmother, a 3 generations photo. Next slide, please. So very shortly afterwards, I had a car accident in Johannesburg in 2004 in South Africa. And at the top right-hand side, you can see what the car looked like. I was a passenger in the car. The driver tried to avoid another car coming into us because they overtook us on the wrong side of the road. The car went into a violent spin and we smashed into a concrete wall. And I was taken to Charlotte Maxeke Johannesburg Academic Hospital because I had several life-threatening injuries. I had a major abdominal injury which required 2 laparotomies at the time. I had a fractured pelvis, I had a neck injury, I had a back injury, and I also had this is kind of the lay perspective, broken nose, broken jaw, smashed right maxillary sinus, orbital blowout. I lost the right eye and I had severe facial lacerations. Next slide, please. So even though I had all those injuries, the most complicated were to my face because I needed to, when I was discharged from Charlotte Maxeke Johannesburg Academic Hospital, I needed to reconstruct my face. And in my 6th year, I had a prosthetic implanted, an alloplastic prosthetic implanted. Next slide, please. So one of the things that I experienced in South Africa, even between public health and private health, was very fragmented care in terms of managing my infection. As I said, in my 6th year, I had a prosthetic implanted, and when that was done, I was discharged from hospital. I went shopping one day. I got back into my car, and I pulled down the rear view mirror, and I felt moisture on my face, and I thought, what's going on? Anyway, then I saw this coming out of my face. So on the bottom right-hand side was pus. You could see pus coming out of this prosthetic. And so I phoned the plastic surgeon's offices and I said, what is this? I've never seen this before. And so he said, this is probably an infection. You need to be admitted to hospital for an emergency surgery to clean the prosthetic, which we did. But when I was discharged, 2 weeks later, the infection came back again. And so I would visit my plastic surgeon, I would go to my maxillofacial surgeon and so on, trying to figure out what was going on. We did surgery, we did, debridements and so on, but 2 weeks later, the infection came back again, but worse. So for the third time, I went to go see an ENT surgeon because both my plastic surgeon and maxillofacial surgeon said all your sinuses were completely destroyed in your accident. So let's do a sinus drainage. So we did that, but the infection came back for a third time. So we were going to go for like a fourth or a second sinus drainage. And the plastic surgeon who I now had a good relationship with said, if I see that infection is still on the prosthetic, I'm going to remove it because it's either going to become sepsis or a bloodstream infection. And so I kind of took him with a pinch of salt because I hadn't signed anything. I didn't know what was going on. I just thought, infection's an infection. But when I woke up from that fourth surgery, the ENT surgeon told me that the prosthetic had been removed and it had been sent off for testing. So you can go to the next slide. So at this point in time, 11 months later, this is what my test results looked like, and this is what my face looked like. I could not keep an artificial eye in. The tissue had been so badly damaged by bacterial resistance. And yeah, just seeing this, I kind of saw like lots of R's and S's going down the test. And I thought to myself, what is this? I've never heard of this before. So the R meant I was resistant to certain antibiotics. The S meant I was susceptible to certain antibiotics. So you can see on the left-hand side, that was the antibiotics that I was susceptible to, meaning that they still worked. The R meaning that I was resistant to them. Next slide, please. So they put me on a last resort antibiotic called vancomycin, which according to the tests would work for me. And also I had to wait a year before they could do any surgery. And, obviously I didn't want to live with this facial disfigurement or facial difference, as it was at that point in time. So I put together a medical record in 4 pages into an MS Word document, and I pleaded for help over email to different surgeons that I found over the world, because in Johannesburg we have a shortage of surgeons, particularly craniofacial surgeons. So I was very lucky that there was one from New York who referred me back to a maxillofacial professor back in Johannesburg. And then there was one at the Brigham and Women's Hospital who worked in the face transplant unit that was willing to give me a little bit of advice. So we did a 30-minute Skype call, video call, and he said to me, Vanessa, no more foreign objects. You need to use the bone that you have left, move it forward so that you don't have to do any kind of like major plastic surgery. And he said, now go home, go back to Johannesburg and find a doctor that can do that, which is exactly what I did. So on the bottom right-hand side is Professor Johan P. Reinecker, who ended up doing that surgery. It was called the zygomatic osteotomy. The top right-hand side is what I look like today with lots of titanium implants and so on. And I always call myself the bionic woman. And I wonder why I get through airport security with all this, kind of like different foreign objects in my face. But yeah, it had a good result. Next slide, please. So yeah, even after waiting that year, the infection reappeared. It was like a bad case of deja vu. This time, not only in the skin, but also in the bone. I also had developed an allergy from the antibacterial ointment, which I was using on the surgical site. So what happened was Professor Reinecker rotated different types of last resort antibiotics. It's very important that we understand that antibiotics come in different classes. So he also sat with me and he said to me, Vanessa, if you take this antibiotic, don't give, if you start taking it at 5 p.m. in the afternoon, take it at 5 a.m. the next day and set your alarm, because you do not want to give this bacteria a window of opportunity to mutate. and I followed his advice really, really strictly. I also made sure that I washed my hands as much as possible before I touched my face. And you can go to the next slide. And eventually, after 3 months of rotating those antibiotics, the infection finally cleared. So just to be completely clear, I had a 10-year facial reconstruction. I had the car accident before, 3 years of fighting resistant infections. And I know that my face is not perfect, but the most important thing for me was to finally get rid of this resistant infection, because when I was sitting in that situation, all the antibiotics I was being prescribed weren't working. You know, I live with this right now. I live with this facial disfigurement. I live with this facial difference. And I avoid surgery as much as possible unless it's absolutely necessary. So next slide, please. So in 2013, when I finally got over my surgeries, something really bothered me. And one of those, the biggest things was that AMR was not common knowledge. I had never heard of this before. Antibiotic resistance was something I'd never heard of before. And I was such a high-risk patient. Why was it not being discussed? Why was it not available, you know, immediately online and so on? So this is kind of a snapshot of in the last 11 years, so obviously 2013 I started, last 11 years of me going out and saying, let's make it more visible to patients. We need to understand this so we can make more informed decisions in so many different areas. But also, we as patient advocates can also work with medical students and stewardship teams and so on. So the purple graphic in the middle is actually me going back to Charlotte McSake Johannesburg Academic Hospital, where they invited me to work with a stewardship team to share my story. And that was amazing because they actually saved my life at the time of the accident. And, you know, so I felt like I was really making a difference. The top right-hand side was an online course that I shared my story in. And yeah, I mean, this is only a little bit of stuff, you know, but it's really important that we as patients raise our voices to share our experiences. So next slide, please. But it's not about me. It's about other patient voices. So I just want to talk a little bit about the WHO Task Force of AMR survivors. At the moment, I'm the chair for this task force. And this is such an important, you know, you as media, you could reach out to us in terms of what we're doing. So this task force is made up of 12 different survivors from different countries, including Zimbabwe, Indonesia. We all have different experiences around that. Next slide, please. So this is a recent campaign that we launched. I don't know if you can see the QR code on the slides here, but basically, if you could type in WHO Task Force for AMR Survivors, you'll find our videos that we've created. You'll find all the other assets that you could be using, not just during World AMR Awareness Week. And I actually saw somebody put in the post in the chat that this is not just about World AMR Awareness Week. This is about an ongoing campaign because patients should be at the center of everything that we do. Next slide, please. So this is also a really, really important document. What we've done together as the 12 members of the task force is to create this meaningful engagement of patients, survivors, and carers in addressing AMR. I'm going to go through a couple of things that are inside of the document in a second, but you know, when people say, how do we work with patients? How do we work with the public? How do we work with carers and survivors? This document is, as I say, put together by patient survivors, and it aims to guide technical experts and policymakers in identifying opportunities. So, so for me as a patient, I've worked in medical education. I've shared my story, and it's really accelerated, you know, in the sense that medical students understand finally what the human impact is of AMR. We can go to the next slide. So let me list the different sections of that document. First of all, public awareness, health worker education, again, going as a patient, talking to medical students. One of the things when I was in charge at McSeke, Johannesburg Academic Hospital, was that I never met my treating doctors. It sounds crazy. They were working at Wits University, but I was working with the interns and the nurses. And this kind of communication could be accelerated if we kind of focus on that. So, sharing our stories in medical education is so important. Healthcare delivery, patient advocates can provide peer support to other patients. Policy making, and this is something that I've done, is so important. Listening to the human aspect. We can keep on mentioning the statistics and the numbers, but when we listen to the patient story, we really relate to what that means. Of course, advocacy. Next slide, please. National action plans. I've been working in the National Action Plan in the UK, as you can hear, as I said, South Africa. And if you look at the latest UK National Action Plan, it has a very strong emphasis on patient engagement, which is as it should be in most countries, because when we do that, we understand the human impact, and we can, adapt our models to make sure that it's patient-centered. Publications, again, very important. Medical conferences, for anybody that attends to know that, this is what happens to people on the ground. Public health innovation, and research and development. So I think that I'm done because I think that I've gone over my time. But yeah, thank you so much. I just want to say, encourage you all as media experts, try and involve patients as much as possible. And even if you come to the WHO Taskforce of AMR survivors, we are 12 members. But, try and seek out patients in your own geographic area, because this is so important to bring the real life situation and the reality to what AMR is doing to patients on the ground. So thank you very much for having me.
Thank you very much, and salutes to you, Vanessa. And I'm sure the point is well taken. The emphasis on patient involvement to show that AMR is invisible, but I am not. And one thing that we need to fully understand is that no one is immune to AMR. Apart from illnesses, even an injury or a surgery or such incidents can expose any one of us to the hazards of antimicrobial resistance. Now, last but definitely not the least, let us listen to those who do not want a future where AMR is posing a global health threat, the young people. We have with us Audrey Wong, chairperson of Quadripartite Working Group on Youth Engagement for AMR. Welcome, Audrey.
Thank you so much for the floor and for me to share a little bit more about what you feel about AMR. And I'm gonna share my slides. Okay. And for us youth, the question is always, what will our future look like? And looking at the AMR landscape now, and the question is, do we have enough policies? Do we have enough resources to address AMR? And will my future look like now? And how will it look like in 5 years, 10 years, or even 30 years? And as a young pharmacist, I actually see cases with young patients developing antimicrobial resistance, and it's very heartbreaking to see that. So, as a pharmacist, I also take different approaches about how to address AMR. And of course, the question is always, what can we do as an individual? Because not everyone might be working in this area right now, and they're also interested in getting more involved. And as an individual, I will always suggest that we can start with behaviors, which means you can start with hygiene practice, for example, washing your hands, getting vaccinated. And of course, as a pharmacist, always is not to self-medicate and to follow the medication instructions. But there are a lot of people thinking about what they can do and how they can bring different experts together and then people from different backgrounds together to address AMR. And in a lot of presentations and a lot of conversations, we already know how important it is to address AMR and the urgency. And for youth, we actually have taken a lot of different initiatives to address AMR. So for example, we have a global AMR Youth Summit also there are youth doing different hackathons, being researchers, writing articles, and as well as being involved in their national action plan. We are also connecting with a lot of community members, hoping to push for more behavioral changes and different structural changes. And as a driver with our community engagement, we are hoping to do more for sure. And we already know that it is important that when we prevent and mitigate AMR, we need a One Health approach, which means we need everyone. And bringing different people from different background and different cultural background, academic background together, we actually launched our Quadripartite working group on youth engagement for AMR last October. We currently have 14 members from around the world, also from different backgrounds, sharing different perspectives about how we can actually address AMR. Something that we do as a working group, first, we actually have a storybook that we recently launched talking about malaria, as we know that AMR is not only an issue by itself, it is interconnected with other infectious diseases. So, for example, malaria, HIV, TB that we all seen. Other than that, our working group is also presented at different meetings. For example, the multi-stakeholder hearing, also at World Health Assembly, as you can see here. One big thing that I also want to talk about is that what do youth want, right? So the question is, what do we see this and what do we want? We actually launched a youth manifesto leading up to UNGA high-level meeting on AMR back in May, prior to the multi-stakeholder hearing. And if you want to read the full version, this is the QR code. So you can scan the QR code to read the full version. It is led by our working group, but co-created with more than 90 youths around the world through consultations and online survey. So we really hope to hear from everyone. Now I want to move on into different priorities that we actually have as youth. There are four main ones that we have identified after the consultations and learning more from the surveys. So the first one, advocacy and engagement. Youth is always very passionate about advocating for AMR, and we are very ready to address AMR through different things. For example, youth-led organizations, youth-serving platforms, especially with getting more involved with decision-making processes. And another focus that we want is the co-creation of opportunities and networking among youth, but also with different experts. So the question here is, how can we do that? And the second one, priority is education and capacity building. As we know that, we need people who actually know more about AMR. So in this priority, we focus on strengthening the curriculum at all levels to make sure that everyone gets to know more about what AMR is and what we can do, but also to co-create different trainings, as well as investing in encouraging youth using different ways to advocate for AMR. It can be through research, it can be through campaigns, it can be through policies. The first priority is patient care, because we know that patient care is core. In patient care, we push for equity and access to care. Also, we mentioned about strengthening the surveillance system and increasing investment in prevention, which we heard a lot of times. And the last one is addressing AMR with a One Health approach, which we know the One Health approach is a big concept that we continuously talk about. And we want to see how the multidisciplinary collaboration will work and how we will use the existing resources that we have right now. And now hearing all the parties, of course, then the next question is, so what is the next step, right? So the next step is that we come up with four main call to actions, as well as different things that we think can be addressed at this high-level meeting. The first one is to ensure meaningful youth engagement in policy, advocacy, and program implementation. It is great to see that in the final version of the declaration, it actually mentions about including youth in the design, implementation, and review of the National Action Plan. So now the question that we want to actually follow up at this high-level meeting is how? What would be the strategies that they would actually do that? So that would be seeing how youth can be a part of it. Second, foster multi-stakeholder collaboration to establish capacity building initiatives. And we see that there are a lot of initiatives going on. But now the question is also, how do we feel youth as a partner? And what are some resources and support that we actually have for them with different youth-led initiatives? Now, the third call is to encourage countries and key stakeholders together with you to co-create the strategic plan, which means that we really focus on the word co-creating, which means we are not only being informed, but like there are different stakeholders coming together, having a specific system to co-create this strategic plan. And the last one is to enable youth networks to use the AMR-related information, which means the main key question here is, how will we utilize the existing resources that we have? Have we utilized all, or do we need new resources? And if so, what would that be? To really drive to see what do we need to do next. Currently in the declaration, we see that there are 44 commitments with 4 different follow-ups. And as youth, we are really passionate about being in the workforce and to drive this movement, and of course, like to advocate more, to do more for our AMR. So I think the question right now is, how can we actually be a part of it, and how can we work together to actually address AMR? And I really hope that at HLM we can see more and more explanations, or to see what the plan will be, and especially the next step. If you want to know more about our working group, you can also scan the QR code here to learn more about the work that our working group is doing. Thank you so much.
Thank you very much, Audrey, and thank you for lending that strong youth voice to this briefing today. And thanks to all other panelists as well. We open the session for questions and comments from the audience. We will prioritize questions from the media first, and participants, please be welcome to type in your questions. We already have many questions, and due to paucity of time, if we are not able to take up all of them, the panelists who would wish to share their email IDs with the media so that they can contact them later on, please do so in the chat box. But that is up to you. I read out the first question from Kat Lay from The Guardian. How well does the current declaration text align with what the Quadripartite Secretariat had hoped to see coming out of the HLM? Dr. Yvan, would you like to answer that?
I think that's one for Dr. Jean-Pierre.
Okay, sorry. It's for, yes, but you are Dr. Jean-Pierre is not there, I think.
I'm here.
You're there. Oh,
Really?
sorry. I just thought you had left. Sorry. Yes, the question is for you.
I'm around.
Yes.
And
Okay. Please.
Question.
Yes.
Thanks for the question. And we contributed, as I said from my presentation. Technically, we provided our support to the member states. We gave them sufficient information of what we believe are the right strategies to address AMR. And as I said, the key message from us was to request the member states to give us something specific with clear responsibilities, and as well to really be bold and give us something that's going to drive the agenda for the next decade or so. So if you ask me my assessment today, we are quite positive with the current draft. As you know, it's not yet over because there will be the meeting, to decide on it or to discuss it. And of course, we will be happy to keep pushing for more specificity and bigger commitments towards addressing AMR. It's a member states driven process. It's their process. So we don't have authority to write it or to completely change it. But we believe it's really giving us a good path towards addressing AMR. And we're looking forward to see how the discussion goes during the September meeting. And we're hoping for more improvements even from the current draft moving forward.
There Thank you. There are a few more questions for you, Dr. Nyemazi. Les Leverington wants to know, how will stakeholders like WHO and others support the November ministerial meeting in Saudi Arabia?
Yeah, thank you. Thank you for the question as well. I was trying to respond, but probably didn't send the info. The ministerial meeting is also another big opportunity, you're right. And it's going to be the fourth. The last one happened in Oman in 2022. So this one is going to be critical. And I'll share the link to that ministerial conference, at least for you to have the basic information. And it will be, I think, sure, you like the theme. The theme that has been put forward is to from the declaration to the implementation. So basically, this meeting is happening right after the UNGA, which gives us political commitments. And then this meeting, which happens in November, the idea is to make sure that we translate those political commitments into tangible, or let's say, really the key actions to drive the implementation on the ground. So how the media would help, I think we'll keep you updated as we move forward. Already you know the dates, 15 to 16 of November, raising again the awareness, ensuring the accountability from our leadership, getting the public as well informed, and pushing all of us, and as well doing your own role to try to communicate about the importance and the relevance of all of us focusing on AMR, because it's really a real threat. And you can really act on it, as my colleagues have really given you some of the strategies going on in different sectors. They are really concrete strategies that can really help us to reduce the burden of AMR. So the ministerial meeting is going to be another big opportunity where our leadership, the ministers from all the sectors will meet, and they will then take from the declaration to the implementation. So we need to support that process as well. Back to you, Shobha.
Thank you. Thank you very much. There's a question from Kalpana Acharya. She's a very senior journalist from Nepal, health and editor of Health GB online Nepal. And she wants to know, are there any specific plans which the organizations are going to implement for using the media together? And how can media be used more fruitfully? Of course, I think every speaker has outlined what media should be doing. But any specific plans, she just wants to know. Any of the speakers can answer that, please.
Checking Thomas, if you're around, probably you can give a comprehensive one.
Yeah, sure, I can. I mean, Kalpana, thanks for the question. And as you may know, there is the Quadripartite Joint Secretariat on AMR, which is expected to be the lead in coordinating AMR action across the world. And media, as somebody said, is one of the top priority audiences. So we are coming together regularly to find ways. This press conference or this meeting, for example, is an example of the Quadripartite coming together. And this is the first step. But we will be doing many more of this. And we are hoping that partners like Gamma and others, new ones will come up that will make this better. But certainly there is a commitment, there is a plan, and happy to engage offline to go into further details and see how you can engage in your partners.
Thank you, Thomas. There is a question for Dr. Holy Akwar from a pet animal veterinarian currently studying as a research student. The person wants to know, is there any significant issue regarding AMR between humans and their pet animals? What can I do and study to make an impact on AMR prevention?
Thank you for that question. Yes, there is always, as we've said in many presentations, a linkage between humans and animals when it comes to resistance. And as my colleague said, as you know, almost 70% of infectious diseases of humans are zoonotic, meaning that they get them from animals, or the transmission is between animals and humans. So once resistance develops in animal through various methods, it could be direct or indirect, through the food system or through the environment, through these genes, resistant bacteria spread, as we heard from one of the survivor, the resistant gene spread. within bacteria, and from the resistant bacteria, they can affect humans. It could be farmers, it could be the veterinary professional, or even the public at large. So it's one of the things where we're also calling for significant investment to establish and quantify the impact of resistance in animal affecting resistance in humans. This is a critical link that has not been properly studied or looked at. If you look at something like whether it be Campylobacter resistant, if you want to really control resistance of that particular pathogen in humans, you're better off controlling resistance of Campylobacter in poultry, and a lot of such links can be established. So I would say yes, there is, even though there is still a huge gap in terms of research to quantify this, but there is a serious linkage between gene flow from animal to humans and vice versa. If somebody who has resistant bacteria is dealing with animals, there could also be transmission from humans to animals. Thank you.
Thank you. Ithan Eo from Finlit Media Malaysia has a question for Dr. Yvan. Ithan says, recent studies in my country, Malaysia, found that a huge contributing factor to AMR was the inadequateness and inappropriateness of antibiotic prescriptions. Dr. Yvan mentioned the AWARE system, and it got me wondering if these resources are actively contributed to smaller countries. Dr. Yvan, there is a similar question from Dr. Jaya Sridhar, who's a health and development journalist and a medical doctor from India. She wants to know, are there studies showing how prescribing physicians follow this guidance of the AWARE pyramid?
Thank you so much. So first, yes, there are some studies, but most importantly, we would like to have this monitored in routine as part of the accountability framework of implementing National Action Plan. And it's actually one of the targets that is in the latest version of the political declaration, so that 70% of antibiotic use in the human sector would be from the access category. So ideally, studies to understand things in depth, why not? But most importantly, monitoring. In terms of the question in Malaysia, about Malaysia, we will not generally speaking comment on individual countries, but I think we can comment on what we do. So we have, as part of this AWARE system, this wonderful book, and I will include the link in the chat, that basically goes through the most common syndromes for which antibiotics are overused. And for each of these syndromes, it will usually refer the clinician to whatever, usually an access antibiotic that is that can be used. So we are actively, this I would say is the keystone of our AWARE system. And along with this, we have all kind of interventions on what we call stewardship, which we're promoting to all the countries through our regional and country office. Thank you.
Thank you. And there is, in continuation to that, there is a comment from Patricia Mokim, who's a social activist, journalist, writer, and editor of Shillong Times in India. She says that we in the media are ready to provide space for medical professionals to push their messages through our outlets. It would be beneficial if this is communicated to medical professionals that the media is with them to carry forward the correct messages. And she also adds on to say that in the northeastern region of India, there is high HIV-TB co-infection due to high drug use via the IV route. And a lot of resistance is occurring because of that.
Would you like me to answer this?
Yes,
so,
if you could.
Yes, I think this question I've answered in the chat.
Oh, yes,
we have resistance also for HIV and TB, and the same as for any other macros. We need to address resistance by preventing, diagnosing, and appropriately treating these infections. In terms of the offer from the media to assist and reach out to doctors, this is much welcome. So you're most welcome to reach out if you are in India to our country office in India. and say that you want to be mobilized and reach out to disseminate some message in India in relation to AMR and the HLM. And I would encourage also each and every one of you to reach out to your national healthcare worker association, the National Medical Association, the National Nursing Association. I'm sure that all of these professional bodies who are highly mobilized against AMR will also be very pleased to share their thoughts on the subject. So thanks for this offer.
Thank you. Charles Ogalio has a question for Aitziber. Kindly help us understand how AMR and climate change correlate. Do you see climate change threatening the efforts to tackle AMR? And what's the way forward for us journalists concerning AMR reporting on this issue?
Thank you. That's a very good question, and I would like to have the magic formula. What we know these days is that the climate crisis and AMR are two of the greatest and most complex threats the world is facing. Both are high in the political agenda, and both have been worsened by, and very importantly, both can be mitigated by human action. The linkages that are already established is like higher temperatures can be associated with increases in AMR infections because some pathogens are more environmentally persistent in response to rising temperatures, and extreme weather patterns can also contribute to the emergence and spread of AMR. For example, we are seeing, unfortunately, a number of floods, and with the floods, the wastewater systems are collapsed, so that is not helping in tackling AMR. Antimicrobial also impacts the microbial biodiversity, and that may affect the natural cycles of carbon and methane, which are directly involved in regulating Earth's climate. However, since both are very complex, studies are being carried out to examine the relationship between AMR, climate change, and pollution. I wouldn't say they are incompatible, and I feel that this is also a very important message for media to understand and to spread, because it's on the contrary, many of the root causes of both are, if not common, really linked, and by preventing one, we have co-benefits in other aspects. So tackling the environmental triple planetary crisis of climate change, biodiversity loss, and pollution and waste, with doing that, we are combating AMR, and with combating AMR, the environmental dimensions of AMR, we are, of course, protecting and saving lives. So it's all interconnected, and I don't think they are, in any case, one contradicting the other. I would like to invite you really to check the UNEP report. I'm going to send the linkage. And also the Global Leaders Group on AMR have an informative booklet on the climate crisis and AMR. So I will be sending both links to, I will include them in the chat for easy of reference. Thank you.
Thank you. Thank you. There is a question from Gibraltar Janetsa from in Zimbabwe. What methods and policies have the WHO put in place to be inclusive of persons with disabilities in the awareness, prevention, and accessibility of service campaign, since they are equally at risk of AMR? Would any panelists want to answer that?
Would you mind repeating?
Yes, yes.
I couldn't see the question in the chat, so I tried to
No,
reword.
it is, yes, it is in the chat. It is in the chat box. Yes, not in the Q&A box. What methods and policies have the WHO put in place to be inclusive of persons with disabilities?
Yes, that's what I thought. Yes, thank you. So we're actually working on it right now. We have one of our proud staff members that is personally affected by a disability, who is working on a policy brief on AMR and disability. And I think the illustration that we had from a patient perspective also illustrate the link. very often orthopedic surgeries that tend to be repetitive for people suffering from trauma or disabilities lead to a risk of AMR. So right now, we're still working on it, but one of our staff members actually personally affected, therefore with a personal connection, should be delivering quite soon some policy brief for people's review. Unfortunately, not before UNGA. Thank you.
Thank you. There is another question for Aitziber, that are governments making promises to prevent AMR in the climate treaty too? This is from Loyola.
Thank you. I think that we are not yet there, but as I say, indirectly they are. So let's keep it that way. But this is one of the things that I was mentioning in the presentation, that we need to make sure that the agendas are speaking to each other and understanding the common grounds. So I don't think, as far as I know, that there is a concrete commitment on that, but we are working on that. Thank you.
Thank you. There is a question from Mogaini Nathan, that do we have any focus on supporting laboratory systems in low resource settings? We realize that proper diagnosis is key in alleviating disease-resistant pathogens. Is enough importance being paid to them?
Yes, definitely. I think this is a very excellent question. We said that we need to prevent, diagnose, and treat infection. So we recently put together some project which we call the Diagnostic Initiative, which has a number of pillars. In the interest of time, and because I have to walk to another meeting,
yes,
I will not be able to go in detail, but I will put the link in the chat. And strengthening the capacity to diagnose is really one of our key focus. Thank you.
Yes, thank you. Just one more question I will take. I know we have exceeded time limit also. There is a question for Dr. Holy, that has WOA released any list of antibiotics for usage in animals at global level on the template of AWARE, as shown by Dr. Yvan. This will assist veterinarians to not prescribe the most volatile ones, which are more susceptible for resistance.
Yeah, thank you very much. I provided an answer in the Q&A, but also just to say it verbally, yes, WOHA is taking the list of essential antimicrobial very seriously, and we are currently, we've initiated a program to create the Vet Aware, which is the equivalent of the WHO Aware for animal health. And that will be coming out very shortly, and working in close collaboration with WHO as well. So yes, that is in the works, and we will soon have the equivalent Vet Aware to guide veterinarians in
okay.
choice.
Thank you. Thank you. Just one last question, and I am really thankful for the panelists to staying over time with us, but just see how much interest this has generated, how much interest this briefing has generated amongst the participants. Dia Anita Ariani Kuriansin wants to know, is there any report from UNEP about the impact from climate change to AMR in livestock and aquaculture?
Thank you. Thank you so much. Yes, indeed, it's very good to see these exciting questions. And yeah, as I mentioned, I would suggest to check the UNEP report that, as far as I understand, is the most comprehensive one for the time being. We will be, of course, working on more, but for the time being, I have put it on the chat. So please have a look to that one. Thank you.
Thank you very much. And I'm sure this discussion can continue endlessly, but we have to stop somewhere. And as I requested, if the panelists would like to share their emails, they can do so in the chat box, so that media can keep on coming back to them with whatever clarifications they need. So with this, we come to the close of today's Global Media Briefing. My sincere gratitude to all the speakers for their valuable inputs in making this media briefing a success. They not only helped us understand the various nuances of AMR, but also that we are to prevent it. If we have to prevent it, we have to work together with sectors like animal health, human health, food and agriculture, and our environment. One Health approach which is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems, is so critical to prevent AMR. It recognizes that the health of humans, animals, and wider environment are inherently linked and interdependent. So by adopting a One Health approach, countries can take a more holistic and systematic course of action to control AMR. Thanks to the quadripartite organizations, FAO, UNEP, WHO, and VOA, for extending their unstinted support for today's session. Special thanks to Diriba, Thomas, Philip, Mimi, and all others from the WHO headquarters AMR ACA team. And last but not the least, an applause for all our participants for enriching the sessions with their active participation through questions and comments. Before we end, we have a very special announcement to make, so please watch your screens. As many of you must be knowing, Global AMR Media Awards 2024 is open since May 2024 and is accepting applications till October 15, 2024. Please submit your media reporting on AMR for the awards. From today, that is September 11 to 15th October, we will add a special category for the Global AMR Media Awards 2024. The category is In-Country Media Reporting on UNHLM on AMR. All details are on the website of Global AMR Media Alliance or GAMA, which is www.amrmedia.org. All the best to all of you to push our world leaders to make stronger commitments in tackling AMR at the upcoming UNHLM on 26th, UNHLM on AMR on 26 September, and walking the talk with robust local actions in their respective countries. Please stay in touch with us. We will continue to update you whenever we get any important information around UNHLM on AMR through the GAMA website. And above all, protect yourself from the hazards of antimicrobial resistance. Goodbye till we meet again. Goodbye.